I know that you're looking for ways to actually do things differently. The businessmen, sila Mr. Joey Concepcion, they have come up with this bakuna bubble proposal, no? In order to save the MSMEs, no? What about that? Is there a way to actually concurrently observe both the bakuna bubble and the granular kind of lockdown minus the general lockdown that we do now?
Palucci, I guess the thing first to consider um, is it the right time to do the bakuna bubble at this point? Kasi the premise there is that it will work if vaccines are indeed transmission blocking and you have enough people in the community vaccinated so that those who are inadvertently infected won't pass it on to others. So when we talk
Which
about
we don't have, no?
both of which we don't have, di ba?
Yes.
Parang yung transmission blocking pa lang, napakalaking issue na yan. Inuulit-ulit ko parate, di ba? Hindi siya nakakapigil sa panghahawa or sa pagkakahawa or panghahawa. So alam na natin yun. So okay, granted, okay yun. Tanggapin natin na yan talaga yung inherent limitation ng bakuna ngayon. Pero kahit magkahawaan tayo, for as long as marami dun sa ating population ay bakunado na, mababa pa rin ang magkakaroon ng risk na ma-ospital, tanggap natin. Pero yung second part of the premise, hindi nag-work eh, kasi konti pa lang yung bakunado sa atin. So, I would think that maybe that time will come, but not yet. And also, lalo in the context of the higher transmissibility of Delta. Not only do you have a fairly small proportion vaccinated, you're dealing with a variant that's actually taking advantage of all of these loopholes. So, I would think timing could be better.
But they're saying that at least in NCR, medyo it's very probable that we will reach at least herd containment very soon, no? Hopefully by October. Is that something that we even see practicable by October or maybe November? I ask because for the businessmen, this quarter is really critical because, well, sinasabi nga nila, pagkabagsak pa rin ng husto ang negosyo ngayong quarter, lalong walang aasahan sa first quarter of next year. So I'm just trying to work through their proposal and see whether there's any chance at all that we could go that way.
Yeah. So, if we were to just work with that second part of the premise nga na if we have enough people vaccinated, that might work, then let's talk about what kind of thresholds we're aiming for in the context of Delta. And we're no longer aiming at 70%. Parang with the reproduction number of 5 to 8, the numbers are closer to 85.
85.
So, that herd immunity threshold is much higher. So well,
even containment is not anymore sufficient, no? Yung 40%. Kasi meron ganyan si Secretary Galvez about, I think in March, no? He was saying by September, dapat may herd containment man lang at 40%. So we're not even looking at that with the Delta. Is that what you're saying?
Well, it's a totally different ball game, diba? The transmissibility of Delta is a really difficult thing to surmount, no? But let's say, assuming na lang, okay, let's work with not herd immunity threshold. Maybe let's work with community protection, community containment, diba? Population protection, rather, yun yung term. Then that means also that we have to make sure that our most vulnerables, the A2 and A3, are really highly vaccinated. And I think that one, there have been certain LGUs that have made good headway, but I don't know about the numbers coming from the others. So that would be a good target, might be a possibility, but would be best if we could aim for herd immunity before we even talked about this bakuna bubble.
Doctor, ang sabi niya, the World Health Organization's country representative said something similar today. Kahit nga daw mataas na vaccination rate natin in NCR, ang problema is Delta is so highly transmissible. We're seeing so many breakthrough infections.
Yes.
So kung ganyan, ang tingin namin medyo lalong lumalabo yung bakuna bubble, ano? I mean you can reject it just for that reason, hindi dahil sa kulang tayo ng bakuna. Is that possible na hindi mangyayari yan? Because precisely of the transmissibility of these variants. And in fact, may na-discover na naman bagong variant
Yes.
ngayon sa South Africa.
Na mas transmissible pa raw.
Hindi, baka daw mas transmissible.
Oo.
So let's,
malabo ba yung
yeah, let's unpack it. Ang daming issues di ba? Parang wala nang katapusan. So, yung breakthrough infection, siguro if I can address that first, actually, expected yun di ba? Yung inuulit-ulit nga natin, hindi naman pine-prevent ng bakuna yung pagkakahawa and panghahawa. So, it's a quality expected from vaccinated individuals. So, when we talk about breakthrough infections, it sounds as if it's so negative, but in fact, it's something we expect. So, whether or not breakthrough infections happen, for so long as you have a significant number of your population protected, then that shouldn't be as much of an issue. So rather than focusing on breakthrough infections coming out because Delta is the variant that's going around, our focus should really be, are we optimizing coverage of everybody else? And once that happens, then we can talk about all sorts of variations. Now, with respect to another variant arising, wala namang katapusan yan di ba? Kasi habang kumakalat ang virus, ang COVID, talagang natural behavior, yung lumabas talaga, yung mas magaling makapanghawa, mas magaling mag-cause ng sakit, kasi survival of the fittest So we should expect that as well.